Hello everyone, my name is Skeleton. I am doing my postgraduate diploma in diabetes. I'll be presenting to you on diabetes mellitus and cardiovascular conditions. Alarming figures presented by both the International Diabetes Federation and the World Health Organization show that diabetes is growing at a high rate globally. This is affecting every country, every age group, and even the economy across the world at large. Now, it is predicted that globally by 2040, 642 million people will be affected by diabetes if nothing is done about it. Currently in Africa, more than 16 million people are already affected by diabetes, and the numbers are expected to escalate in 2045 to 41 million people. Now, many people live with type 2 diabetes for long periods of time, unaware of their conditions. In most cases, they only seek medical intervention when complications are present. Now, the number of people living with diabetes will continuously rise if nothing will be done about it, and it will pose a threat to sustainable development. Now, already 12% of the total global expenditure on health globally, it is currently spent on adults living with diabetes. Now, let's take a look at what really diabetes is. It is a metabolic disorder that is characterized by chronic hyperglycemia with disturbances of carbohydrate, fat, and protein metabolism due to defects in insulin secretion, insulin action, or both. Now, there are three common types or three common symptoms of diabetes, being polyuria, polyphagia, and polydipsia. Now, the complications of diabetes are classified into two, being microvascular complications and macrovascular complications. When we are talking of microvascular complications, we are talking of the complications that affect the small blood vessels. For example, neuropathy, nephropathy, and retinopathy. When we're talking about the microvascular complications, we're talking of the complications that affect the large blood vessels, being the peripheral artery disease, coronary artery disease, and cerebrovascular diseases. Cardiovascular disease. These are a group of disorders that affect the blood vessels and the heart. 2 out of 3 deaths are attributed to cardiovascular disease worldwide. Now, the types of cardiovascular disease include coronary artery disease, peripheral artery disease, and carotid artery disease. Now, with coronary artery disease, there is a buildup of plaque in the arteries supplying blood to the heart. While in peripheral artery disease, the plaque is built up in the arteries that supply blood to the limbs. In carotid artery disease, there is a buildup of the plaque in arteries that supply blood to the brain. Now, the link between diabetes mellitus and cardiovascular diseases is in that type 2 diabetes is a major risk factor for cardiovascular disease. About 80% of individuals with diabetes die of coagulopathy, among which 70% are due to myocardial infarction, while at least 30% is due to cerebrovascular disease and peripheral artery disease. Now, studies have shown that the first piece of evidence, that is the Farnham study, it has shown us that people with diabetes are more vulnerable to heart diseases than those who do not have diabetes. This vulnerability is due to prolonged inadequate control of blood glucose levels. Now, also evidence show that patients with diabetes have an increased level of low-grade inflammation of the arterial lining, leading to cardiovascular events. Now, let us look into the risk factors that are relative to cardiovascular disease. These are conditions that put one at risk of developing cardiovascular diseases. Now, I will begin my slide with the non-modifiable risk factors. In this, we have age. According to the American Heart Association computation, about 80% of people who die from cardiovascular disease are 65 years and older. Also, one of the non-modifiable risk factors is gender. Although women tend to develop cardiovascular disease about 10 years later in life than men, the outcomes of cardiovascular disease in women are oftentimes worse than those in men. Other non-modifiable risk factors include the family history. If one has a family member who's had a heart disease at the age or before the age of 55, they should notify also the medical personnel and share that history with them because they are prone also to developing heart diseases. Also, another non-modifiable risk factor include race. Now, studies have revealed that people of Black ethnicities are at greater risk of developing cardiovascular diseases than any other ethnic group. Now, concerning the modifiable risk factors, we have smoking, which is the most preventable risk factor and most cost-effective. The harmful substance in tobacco can damage and narrow the blood vessels. And smokers are more than twice at risk of developing cardiovascular disease than an average person. But it's a pity that even the secondhand smokers, those who are exposed to smoke, are also at increased rate, even though they do not smoke. Now, another modifiable risk factor include high blood pressure. Uncontrolled high blood pressure can lead to stroke by damaging the brain's blood vessels, causing them to narrow, rupture, or leak. Now, high blood pressure also causes blood clots to form in the arteries, leading to blockage in the blood flow. High cholesterol is also one of the modifiable risk factors. Cholesterol is a fatty substance that is found in the blood. If you have high cholesterol, it causes your blood vessels to narrow, and it also increases one's risk of developing a blood clot. Other modifiable risk factors include inactivity, hyperglycemia, adiposity-based chronic disease, which once was called obesity. Being obese or obesity leads to one developing diabetes or high blood pressure, which, as I have said in my previous slide, these are also risk factors for developing cardiovascular diseases. Now, how can we prevent these events from happening in a person living with diabetes? The best way or the first thing that one must do is to manage the diabetes itself. Keep one's blood sugar as normal as possible. Control one's blood pressure. Get your cholesterol numbers under control. In the last 10 years, studies around the world have shown that optimal control of the LDL cholesterol, that is the bad fat, and blood pressure can prevent adverse cardiovascular outcomes by 30 to 50%. Other prevention points include eating a heart-healthy diet, smoking cessation, working to reduce daily stress, reduction in alcohol consumption, and weight loss. Exercising regularly and smoking cessation are two important lifestyle measures that have an impact on preventing heart disease. Studies have shown that even in overweight people, regular physical activity has major cardiovascular benefits. In conclusion, viewers and listeners out there, the best way to delay the development or to prevent development of cardiovascular disease in a person living with diabetes is first of all to manage the diabetes itself. Now, thank you for listening. Thank you for your time. Have a good day.